Hey everyone, are you preparing for the OET exam? In today's video, we'll break down OET Reading Part B, what to expect and how to tackle it effectively. Stay tuned for quick tips to boost your score. Let's get started. OET Reading Part B tests your ability to quickly understand workplace-related texts like hospital memos, guidelines, and policy documents. You'll get 6 short texts, each followed by a multiple-choice question with 3 answer options, A, B, or C. The key is to identify main ideas, specific details, and tone, just like you would in a real healthcare setting. Staying sharp and reading with purpose will help you choose the right answer with confidence. To ace OET Reading Part B, start by reading the question first. This helps you focus on what to find in the text. Skim quickly to grasp the main idea, then spot keywords and their synonyms in the answer choices. Use elimination to rule out incorrect options, especially those that contradict the text. Finally, pay attention to tone and purpose. Is it giving instructions, issuing a warning, or explaining something? Mastering these strategies will help you choose the right answer with confidence. This memo highlights a mandatory training deadline and the consequences of not completing it. The key is to focus on the main purpose. Is it informing, reminding, or explaining? Look for keywords like must complete and by March 30th, which emphasize urgency. Also, note the consequence: restricted work duties. This suggests the memo is more than just general information. Understanding the tone and intent will help you pick the most accurate answer. The correct answer is B because the memo reminds staff about the deadline and the consequences of not completing the training. Always look for key details that indicate whether a text is informing, reminding, or instructing. This guideline provides clear instructions on monitoring INR levels for patients on anticoagulants. The key detail is the required action when the reading is above 4.0. Words like immediate consultation suggest urgency, so it's important to choose the option that aligns with this directive. Be careful not to assume extra information. Stick to what the text explicitly states. Understanding specific instructions like this is crucial for answering correctly. The correct answer is B because the text clearly states that if a patient's INR level is above 4.0, they must immediately consult a doctor. The word required emphasizes that this is a necessary action, not just a suggestion. While regular monitoring is important, the guideline specifically highlights the need for urgent medical advice in this situation. Always focus on the exact wording in the text to choose the most accurate answer. This email announces a change in how nurses record their working hours. The key phrase, required to log digitally instead of using paper, highlights the shift from one method to another. It's important to focus on what is actually changing, rather than assuming additional details. Understanding these small but crucial differences will help you select the most accurate answer. The correct answer is B, because the email clearly states that nurses will now be required to log their hours digitally instead of using paper records. The phrase, instead of using paper, confirms that this is a change in the recording method, not in the number of hours worked or the submission process. Always focus on the specific change mentioned in the text to choose the right answer. This notice highlights the importance of infection control by requiring staff to sanitize their hands before and after patient contact. The key phrases reduce the spread of infection and compliance will be monitored indicate that this is a serious guideline, not just a casual reminder. Focusing on the main purpose of the notice, whether it's about hygiene, a product, or a penalty, will help you choose the most accurate answer. The correct answer is B because the notice emphasizes the importance of hand hygiene in preventing infections. The phrase, to reduce the spread of infection, makes it clear that the focus is on maintaining cleanliness, not introducing a new product or enforcing penalties. Always identify the core message of the text to select the most accurate answer. Let's have a look at a complete passage example. The passage says, to all healthcare staff, ensuring effective hand hygiene remains a top priority in our facility. As per the revised infection control guidelines, all staff must sanitize their hands before and after patient contact using the hospital-provided alcohol-based hand rub. Hand washing with soap and water is mandatory if hands are visibly soiled or after dealing with patients with Clostridium difficile infections. To improve compliance, random monitoring will be conducted, and non-compliance may result in retraining sessions. Staff members who repeatedly fail to adhere to the protocol will be referred for further review by the infection control team. If you have any concerns or need additional training, please contact the infection control department. The question says, what is the key message of this notice? The options which we have are A. Staff must use soap and water for all hand hygiene practices. B. Compliance with hand hygiene protocols will be monitored, and violations may lead to retraining. C. Alcohol-based hand rub is no longer allowed for infection control. After having a look at the passage, we can infer that correct answer is option B, as it's a reminder about the deadline and consequences of non-completion. And that's a wrap on OET Reading Part B. If you found this helpful, like, share, and subscribe for more OET tips.